Hello for everybody. First of all, I would like to thank for invitation because I would say it's my first presentation about sharing experience how we move in establishing HTA in our country. So today I would not speak about Syria, Ukraine. Today I would speak about what's going on with HTA in my country. So I represent, I am General Director of Center of Healthcare Quality Assessment and Control, reported Ministry of Health. And all what we are doing, it's controlled and organized by our Ministry of Health. I would like to describe situation with healthcare in Russia. So first of all, I would say maybe 5-7 years, interest to healthcare was dramatically increased in our country. And so a lot of, and I would say it's comparable with European Union, with Greece, that situation became the same. So all politicians, all people who would like to make political career, a lot of official stakeholder would like to be in center to discuss, to make a decision, to influence on policy of healthcare. So it became popular, and all people who make policy in our country would be involved in healthcare issues. A few words I would say about financing of medicine in our country. So in our country we have main 4 programs for medicine. First one, it's program for disabled population. It's one of the biggest. So in case if patient has disability, it means that this patient could receive free medicine. 7N, it's again federal budget. It's 7 diseases which need very expensive product. Most of them is rare disease. By the way, on regional level, we have a government statement, and the main criteria for providing medicine is social and medical. So, for example, children, 3 years, veterans of war, from one side. For example, a family with more than 3 children, and other one. By the way, other people with bronchial asthma, with some disorders of hematological disorders could receive free products as well, but supported by regional budget. And OMI, it's insurance system on hospital level. So it means that all patients who are in hospital could receive product free. In accordance with our law, we have so-called reimbursement list or essential drug list called in Russia. But actually, it's not essential drug list like WHO recommendation, because you can find a lot of different, very innovative and quite poor product and quite old product in this list. So the main idea of this list is to fix price. So if company would like to buy product in country and they would like to be included in essential drug list or reimbursement list, this company should fix their price. And they could not sell this product with higher price. But I would say following last maybe difficult political situation, our government pushed very strongly, pushed development of our domestic producers, pharmaceutical producers. And here I would like to show you, that we should, it's KPI from our president, so we should get about 90% of Russian or produced in Russia products in 2020. So it's challenge for country, it's quite difficult, but I would say that a lot of interest, a lot of money now was and will invest in pharmaceutical area in Russia. Here you can see different steps how to be included in outpatient segment if company would like to be in this segment. So first of all, they should initiate activity to be reimbursed in a regional program. First of all, then company should make all what they can to support product and to push product to be included in essential drug list. And next steps to be in this 7 high expensive program. And here you can see the KPI which I mentioned before about development of our pharma, Russian pharma 2020. So you can see that in 2007 and 2020 situation should be dramatically changed. So it's just a overview of our medicine market. Now what we have with HTA. I would say that maybe 3 or 4 or 5 years before, we have confusion about 2 different stages of evaluation of drug and medical device. So some people, especially politicians, could not differentiate expertise before authorization and expertise before making decision about budgeting. First. Second one, decision makers and experts couldn't make decision using evidence-based data, health economic data. It was, and I would say it is quite far from them, but it's everywhere. There were no standard operation procedures for assessment medicine and medical device and how to make decision to get more transparent decision. And we had no HTA body in Russia. But I think you all understand that initiate HTA, we could say about methodological approaches, we could say about expert opinion, we could say pharma pushing, but to be honest, it's absolutely political. Absolutely political. So when we speak about pushing HTA ideology, you know, before joining HTA body, I gave a lot of training for pharmaceutical company and medical device industry about market access. And we know that when we collect information, arguments, evidence, during developing of evidence, we should understand needs of our payers, what they really want, and how we could prepare our technology to push them to pay for it. It's always, it was, it is, and it will be. So in case if I would like to initiate HTA, I have the same technology. And I have to sell it to politician and to official. And I have to understand, to realize what's their real interest, how we can respond for their ask. It's only reason, it's from my point, it's only one possibility how to make it interest for them. So during our war against corruption, HTA was established as one very powerful instrument which could help to make more transparent decision. Now, after crisis, after economic difficult situation, we would say that HTA could help us to save money. Not to save money for healthcare, but to send money for different area of healthcare and to make it more efficient. So, we start to think about HTA through 2009. I initiated institute, and we started to push this ideology among different regions, on different platforms, with different stakeholders, with different payers. with different officials. They were not interested, but we tried to involve different politicians who start to initiate. We have 2 chambers of parliament, and we initiate a lot of, I would say, 5 meetings on platform of our Council of Federation and Parliament about HTA. So in 2012, so necessity of HTA was understandable for main biggest part of medical society. And in 2014, we include in our law of medicine term of comprehensive assessment. If we have comprehensive assessment in our law, it means that Ministry of Health, which should be responsible for organization and carrying out of this kind of expertise, should initiate this activity and establish special body or special organization or agency. And in 2015, Center of Healthcare Quality Assessment and Control was introduced. What we would like to expect from HTA? It should be a tool for expert support to decision-making procedures. It should be a mechanism of independent evaluation or assessment, and it should be recognized as a means of integration into international system of health technology assessment. Because you know that globally, HTA is a little bit about epidemiology, about statistics, about evidence-based, and about different application of economic evaluation for healthcare. So when we speak about economic evaluation, it should be specific for each country. But when we speak about evidence-based, we should understand, we should use what European countries, American states, organizations have for now, and we have to be able to use it and to apply for our decision. So it's our government statement about procedures, how it should organize. And here on this picture you can see that before HTA body, it was a process of making decision about completing reimbursement list. After law, where we include term of comprehensive assessment, the situation now is different. And now you can see that on the right of this picture, you can find Center of Healthcare Quality Assessment and Control, and all different players who are involved in assessment of products, I mean medicine, should send their report, their recommendation to Center of Healthcare Quality Assessment and Control. And this center, together with our players, should prepare recommendation to commission under Ministry of Health for making decision. Here I would like to show you definition of what is comprehensive assessment. You can see that first of all, in this definition, we separate HTA with authorization procedures, because approved medicine, it means after authorization. Second one, we would like to underline that we need to compare with products which are paid now by government. So we have to compare with products which are currently used in our healthcare system. Then evaluation of economic impact, additional consequences of using, for making decision about reimbursement list. But now I would say that so far we could not change situation very quick. It's impossible, because all decision which is made by Ministry of Health is political. And a lot of different organizations, like Ministry of Economy, Anti-Monopoly Services, Ministry of Production, which promote Russian domestic products, would like to be involved and would like to influence on making decision about essential drug list. So, Ministry of Health now, to avoid responsibility try to involve in process a lot of different players. And involving a lot of different players makes this process is very difficult and very difficult to manage it. So, first one, in the up of slide, you can see process how it was before. Formal document evaluation, expert organization, then respectful chief specialist, and decision on the level of commission. Now, you can see the Center of Healthcare Quality Assessment and Control on this list. It's second scheme. And what we expect in the future, it will be a little bit more close to NICE organization. We would like to control and we would like to manage all expert organization. So you can see that Center of Healthcare Quality Assessment and Control will coordinate, will manage all different expert organizations, which could be in different regions of Russia. But they should be to get some kind of license to make expertise. And now we are in process how to teach them, how to control them, and how to establish the same system of making assessment. So now we have only one item in our law about comprehensive assessment on medicine. I expect maybe next year we can include not only medicine, but biomedical technologies, probably clinical guidelines, and after this, medical device, biomedical technology, clinical guidelines, healthcare program, and other one. The problem is that we have a lot of negotiation between terms. For example, it's common for us to say health technology assessment. But when we say about health technology assessment, it means that technology could be administrative procedure, could be managerial procedure, could be IT implementation, could be medicine, could be vaccination, could be medical device, and other one. So the question is that health technology assessment is very wide. And now we decided to concentrate on medical device, biomedical technology, and medical device to make it more manageable. And we will see how it will develop in the future. Here on this slide, you can see how our system of healthcare will be organized in next year. Corn in the basis of this is clinical guidelines, which should be developed for most diseases. After clinical guidelines, based on clinical guidelines, should be developed routes of providing medical care or patient pathway, if you want. So how we should manage patients with different diseases. By the way, based on clinical guidelines, we have to develop quality criteria of medical care and so-called medico-economic standards. Medico-economic standards, I would say, digital clinical guidelines. So it means that you can calculate money using these standards. So clinical guidelines should be basis of develop different documents, different recommendations, different orders, how to manage patient in healthcare. So, and now we have started to do it, and I think we need 3-4 years to make it more transparent. I would say that a little bit, it would be close to UK system, because based on NICE decision and based on clinical guidelines which developed by professional association, NICE develops its own clinical guidelines. And in case if technology, medicine or medical device is included, in case medical technology has positive decision after NICE, it means that this technology could be included in clinical guidelines, and based on these clinical guidelines, we could expect changing of tariffs, HRG or DRG. More or less, we would like to do in Russia. So we have to use comprehensive assessment, professional association guidelines, and develop of medical care standard. Based on this standard, we can change our clinical statistic group or its Russian DRG. So I would say that more or less we would like to build very close system for UK in this case. But the main idea of this one is clinical trials, initial basis for evidence, HTA approach, development of clinical guidelines. Follow this, development of quality standard, clinical economic standard. So it's very close, like this picture in the corner on the right, which I gave from NICE. Which I take, sorry, from NICE. Here, it's a little bit about our agency. I don't want to, so. And a little bit I would like to say about rare diseases, what we have now in Russia with rare disease, and how we would like to use MCDA approach for make approach of HTA more wider. So it's definition of rare disease. Rare disease is a real problem for our country because a few years ago, our government and our president pushed ideology that we have to cover all patients, provide free medicine for all patients with rare disease. But you know that rare disease is growing problem, it's growing issue, and it's impossible to provide all what patients with rare disease need. So it's real problem for Russia. Again, based on federal level, we have, as I said, 7 expensive diseases. And usually government provides stable budget for this patient. But we have 24 orphan diseases, and these 24 diseases is responsibility of regions, but region could not provide stable budgeting. So 24 diseases patients usually have problems. Here you can see 7 diseases on the left, it's federal responsibility, and 24, example of 24 diseases, which is regional. Unfortunately, now we have no systematic approach how to budget and how to make decisions about orphan disease. Unfortunately, still on regional level, we have only unstable funding and lack of transparent criteria to make decision which product we should include, which disease we should include or exclude from list of rare disease. We decided to use MCDA approach. What does it mean, MCDA approach, for case of rare disease? First of all, I would say that we know that most rare disease, not all, but most of them, have only one product for treatment. So when we define about treatment of rare disease, we have to choose disease and product. It should be very dangerous disease, but effect of new product is not so remarkable. Or it would not be not so dangerous, but product could absolutely change disease. So we should combine severity of disease and effectiveness of product. Its process. So we have to determine parameters describing efficiency of a drug and the term value for each parameter. It should be made for disease, and the same should be made for product. Here you can see criteria for diseases. Here you can see criteria of characteristics of product. Now we would like to have so-called IT tool in case, for example, now we have 24 rare diseases and we have to separate special budget for treatment of this patient. And in case we have new disease, we have to wait how many scope this disease with this product could get. And in case if this sum of or score will be higher, it means that within frame the same budget, we have to start to treat patient with higher score and don't prescribe products for new patient with diseases which are in the bottom of this model. We could not say maybe it's not fair, but in case if we have limited budget, we have to choose the most efficient decision, no other exit. So, a little conclusion. HTA body is very close to start. Next year will be under all this, what I told you before. There are still a lot of enemies of HTA and people who would like to influence and to make their decision without any kind of assessment. Russia still does not make choice of HTA model. So now a lot of negotiation between NICE model, German models, Sweden models, so it should be made next year as well, I hope. Application of HTA will expand it in Russia shortly. So it will cover medical device and biotechnologies. And I would say that 3-4 years ago, I could not imagine the possibility that HTA could be established in Russia. And the last MCDA could be part of HTA, not replace HTA, but expand ability of assessment within frame of HTA. Thank you very much.